How do you define true ED? And how do you determine what route to treat it? Is there an order of approaches you go through?
That's a tricky one, and like if I was still in urology, I'd probably give you some academic-y type answer. But even then, knowing in urology what we actually do day to day on the real side of things, it's still a lot of just, well, let's try this. If that doesn't work, let's try this. And if that doesn't work, let's try this. It's always a stepwise progression. Now, if something in somebody's history indicates there might be a structural problem, an anatomic problem. I mean, obviously, if a young guy that's been in a car wreck and has had a pelvic fracture or something, that's kind of obvious. But for these kind of random where it's like doesn't make sense that they're having ED because they're healthy otherwise, I would still not try to go straight for like invasive procedures like penile Doppler. Even is not invasive, but it's embarrassing, and it doesn't always going to give. It's not going to always tell you what we should do. It's still going to be like, well, we need improved blood flow, so here's some Cialis, right? Now, if they have venous leak or something like that, that might be useful to know. But I wouldn't jump to that first. That's going to be more a process of elimination. But if you go look at the textbook chapters on ED, my gosh, they're painful and long. A lot of guys, it's obviously psychogenic, or at least there's a component of that. You have to look at everything in their life. You have to look at their stress levels, their diet, their medication list is a huge one. A lot of these guys, even young guys nowadays, are on a freaking blood pressure pill and a statin. So, okay, recipe for ED right there.
Yeah.
And they don't think twice about it. And I'm like, a 30-year-old, I'm like, why are you on a statin and 2 blood pressure? Well, my doctor told me I needed it. It's like, it just kills me, So, we are being poisoned left and right, not just by the food and everything else, but doctors are poisoning people without. And it's, again, I don't besmirch people for taking a pill if they feel like they need it to mitigate some symptom they're having that they're worried about, but they need to have informed consent about that. They need to know, and the doctors have to tell them, hey, I'm going to put you on this blood pressure pill, but here's what can happen. You may start having ED. You may start having swelling in your ankle. I mean, all of this list. And they just don't usually do that. And that's my beef with most providers in general, whether it's surgical side or medical, not most, but a lot. Just be upfront with people, be honest with people about everything, within reason that's possible so that people aren't freaking out. That's the thing. Just know what you're getting into. So.
Mm-hmm.